Welcome to NERI's Conexión 360 Insights, where we bring you conversations with the leaders, researchers, and innovators shaping the future of health in America. I'm Fernanda Durand. Before we get started today, don't forget to subscribe to our YouTube channel and follow us, NERI, on Instagram and LinkedIn for more conversations like this one. Now, let's talk about a critical part of our healthcare system. Did you know that nearly 1 in 4 physicians practicing in the United States today is an international medical graduate? That's almost 325,000 doctors caring for patients in communities across the country. In this year's residency match alone, nearly 10,000 international medical graduates secured positions in U.S. training programs. Earlier today, I sat down with Dr. Julieta Argüelles, founder and president of LATIMGs, a nonprofit organization dedicated to supporting international medical graduates through mentorship, education, leadership development, and advocacy. We talked about a number of subjects like physician shortages, barriers facing international doctors, the future of healthcare, and why supporting this workforce matters for all of us. Here's my conversation with Dr. Argüelles earlier today.
Thank you so much for having me, Fer. I really appreciate being here.
Yes, you were one of our first members of NERI. And so, we're very grateful of the partnership. I wanted you to come on today and tell us a little bit about what made you create LATIMGs. What was the impetus behind this organization and why you wanted to create this for the doctors that are coming in?
Yeah, of course. So really like what inspired me was my own pathway to the US healthcare system. I am an IMG from Mexico, and I was fortunate enough to get a position in research in the US. And while I was there, I witnessed a disconnect in healthcare, like completely. I saw patients waiting for hours for interpreters and just struggling to communicate with their healthcare providers because, they normally don't understand the culture and the language. And at the same time, on the other side, I saw highly trained international physicians that were facing barriers as I was to enter the US healthcare system. So I was like, oh my God, this cannot be happening like in the same timeline. So I really realized that the solution to one problem was just in front of the other. And that's how we created LATIMGs. It was born to kind of help to bridge those gaps.
Was there one particular experience or moment where kind of the light bulb went off, that one experience?
Yes. I used to work in cancer research. And of course, it's not like the more happiest scenario for a patient. And, you're not feeling right, you are struggling. And I saw a patient literally waiting 7 hours to get an interpreter. And I was there and I was like, I'm a physician. I can't help with that. And they told me no, because you need to be certified in this and that. And then I'm like, oh my God, this is just impossible, because for a patient to get the care that they need, they just not need to, to ask for one full day of work that they do, because they lose their whole day of work getting into an appointment. But then they don't have a physician that actually understands them and their culture and everything. So that was one of the moments I felt super frustrated because I was seeing patients that needed us and I was not seeing a healthcare system prepared to serve those patients. And of course, we have a physician shortage. So getting an appointment right now is very, very difficult because there are not enough physicians. So of course, even there are less physicians that can understand your culture and your language.
So tell me the mission of LATIMGs, what you're there to do, how you're there to bridge that gap.
So the mission was, just bringing together these two parts of the game, patients and international physicians, because I was seeing that there was a big need for physicians, and then there was a big need for opportunities as well. So the mission became, putting together a community and environment of international physicians that want to serve our communities in the US. And at the same time, making those physicians to not only not only be good at the clinic, but also be good leaders, good researchers, public health, do advocacy for their patients. So it's kind of a whole environment. And of course, during that pathway, we also included our program that is called Doctors for Doctors, because it's not only creating more physicians, but also retain the ones we have. And right now we are experiencing a lot of burnout within healthcare. So, of course, a lot of our doctors are just dropping off the career because they are burned out, they don't feel well. So, mental health has become a very important part of our organization as well. And that's kind of our mission, just to bring together physicians and patients and to help bridge that cultural and linguistic gap and increase the physician workforce.
So, how are you doing that right now? Tell me some of the programs that you have. I'm very interested in this sort of mental health aspect of it. What's going on and what are you doing? What are the programs?
Yeah, so we have different councils, and each council has their own leadership. And one of our main programs is, of course, clinical research. We also saw that there was a gap in the data for Latinos. Not a lot of Latino patients are willing to enroll to a clinical trial. And it's not because they are not enough, but because they don't have the physicians that can actually, say like, hey, this is the ICF, and explain everything in their own language that they can actually understand. So that's one of the programs that we have, clinical research, because we want to train also the international medical graduates to, whenever they go to residency, to also have this part of research. So we are doing like free trainings for all of our members who want to pursue a clinical research career. We kind of help them to find like job posts. And then we have the TM visa program. This is only for Mexico right now because, there's a specific type of visa for Mexican physicians that they can come here to the US as physician researcher. So for me, it's a great pathway to enter the US healthcare system because you're already in the system. It's just that you need to translate, from clinical research to residency if you decide that, or stay in clinical research, which, it's also like a very, very good opportunity and career. Other of our programs is Doctors for Doctors, mental health. We partner with different psychiatrists and psychologists to give trainings to our IMGs. And we have our community that support each other. We have our special group for Doctors where we are like encouraging each other every time. And we have like our saviors. So we match up one person with another. And whenever you're feeling like super down or something, you have that person at least, So we're trying to make it we're really a family, and we try to support each other, and we try to say like, hey, it's okay not to be okay sometimes, and it's okay to stop because, we as physicians always take care of our patients, but we forget to take care of ourselves, and we put us like at the end of the line. So it's very important for us also to share our stories with everyone that not everything is happiness and success, but we like to normalize, for example, failure. So we're also trying to put those stories into our program of Doctors for Doctors. And we have a lot of psychologists and psychiatrists that are giving like workshops where they can help us just to manage stress and with burnout and all those kind of things. And then we have the academic area. We recently developed the USMLE Step 1 Bootcamp, which is a free training for all of our members and is literally just guiding them through the USMLE Step 1 process. And we have classes and everything from anatomy, physiology, and all the classes. And we also have Q banks, so we can have rehearsals for the real exam.
So that's I want to pause you right there and kind of give me the lay of the land of what's happening now with the visas, with obviously there's just a change in priorities from the government. And so I want to know how that's affecting you all, and also in general the need for more doctors in the United States, because like you said earlier, that was a great supply of doctors that was coming in through those visas. Has that diminished? Is that still the same? What is happening in terms of the visas?
Yeah, it's been, very complicated for the international physicians right now, more along like the J1 visas. And there are a lot of things going on in the government, for example, Conrad Terry. And of course, there are a lot of
What is that? Can you
the
explain that?
Yes, Conrad Terry, there is a policy that allows, like the waiver for the J1 visas. So normally if you're in a J1, you need to go back to your country for 2 years and then come back, which is actually very difficult, because if you're already like a physician here, what's the point of coming back to your country for 2 years before enter the country again? So the Conrad Terry has kind of allowed the physicians for so many years to avoid going back to their countries for 30 years. And it's now, under the legislation, they are seeing if they are closing the current Terry or continuing the program. So it's super important that they continue that program. And then another thing is the H-1B visas. So there was a fee for an extra fee that makes very expensive, for example, for FQHCs to hire an international physician. So and we have seen that most of the international physicians tend to go to primary care and tend to go to FQHCs. So of course, if there's
tell us a little bit if FQHCs are community-based health organizations and are subsidized
by the government.
By the government, exactly.
Right. Yeah. So, of course, if you add that economic barrier to the FQHCs, they are not able to hire international physicians. And what happens with those residency spots? They are not fulfilled. So, what happens with the patient? They are not seen, or their care is delayed. So the other thing is that we have seen that more and more IMGs are seeking alternate pathways in different countries because of everything that has been going on with the visas right now. So, it's very
So what do you mean
disappointing.
by alternate pathways? Just
Yeah. For example,
seeking new careers, or
not really, but seeking another country. For example, Canada.
interesting.
Yeah, it's very interesting actually, because, this is very new.
Yeah.
But different countries are opening more pathways for international physicians to make it easier for them to enter to their countries, because, of course, they also need physicians. And at the same time, the US is kind of putting more barriers. So the new generations are seeing this as an opportunity to go to different countries, which at the end of the day, I'm very worried because we are already in a need for more physicians. And then if all these doctors that were thinking of coming here and be a physician here are going to different countries, this will be a major problem, because the statistics right now are taking into consideration like the normal flow of physicians to the US. But if this changes, if these physicians that are normally here go to different countries, we are going to have a bigger impact in our communities. And of course, the ones that will suffer the most are underserved communities, which are the ones that are normally taken care of by IMGs.
So what do you have to say to either medical students who are living here, who are seeing this landscape perhaps as a dire situation, or even those that are living abroad that want to come and practice here?
Yeah, that's another part of it, because medical schools now have less scholarships for med school. So a lot of the pre-meds are also thinking about other options. And for me, the other option is become an IMG. If you cannot like support your studies in the US, go to Mexico, for example, or go to a different country to get your MD and then come back as an IMG. I think it's a great alternative. And for our med students, international med students, I will always recommend coming to the US. I mean, we have a big gap, and we have over 30% of Latinos in the country. So yeah, and only 6% of Latino doctors. So you can see there's a big gap there, and more of doctors that actually speak Spanish, for example. So for our Latin medical students, I will encourage them, to seek these opportunities and to get mentors. This is super, super important, to get mentors, to seek a community that can support them, that can guide them through the process, because it's really very difficult to walk through this process alone. And a lot of things are changing every day. Either ECFMG changing their platform literally every day. Well, not literally every day, but very, very common. They are changing the platform and changing everything. So I think it's very important to stay informed, to follow communities that can help them, and to seek a mentor. That's one of the biggest things.
And what would be your message for sort of the general community? It seems that we keep saying this message, there's not enough culturally educated doctors, and yet we seem to be going in the wrong direction. Why is this a message that should appeal to everyone?
Right. Yeah. Well, first of all, our organization, our goal is to help our patients, to help them feel that they are heard, that they are, taken care of, and that there is people that can actually understand them, like culturally and linguistically. So I think that's very important for all, because we need more physicians, and not necessarily from Latin America, but we need more physicians that can understand our communities, that can speak their language, that can be there, and can have appointments. There are some patients that wait 6 months or 7 months to get an appointment right now, and it's because of this, because of physician shortages. So I think that's very, very important to all of us, because what will happen if, for example, my mother needs care and she will need to wait for 7 months to see a physician, you know? And what happens in those 7 months? A lot of complications will happen. A lot of patients will go to the ER. ER costs are way more than normal costs. So even the healthcare system will suffer that part, because the cost will be more if the patients go through the ER than if they go to the primary care. If there's a way that we can have more primary care doctors, it will definitely be a big difference, because we can prevent the disease before the disease appears, and we can even save a lot of money doing that. Yeah.
Yeah, that's fantastic. That's right on. And we have such a lack of planning, it seems, in the medical system. We're not like looking enough down the line as to what could be happening down the road in terms of public health.
All right.
In terms of your organization, what do you see as the next 5, 10 years for you? What is kind of your mission? And
Yeah. So our goal is not to match as much of our members as we have, but more to have members, the members that we have, to be leaders, to be in the table where decisions are made for the healthcare system, to be there, to be compassionate physicians for their doctors, and to also to remember where they come from and to help the other one behind them. That's kind of our mission, to always have this ripple effect, where the attendings help the residents and the residents help the interns and so on. Because at the end of the day, that's what the community is. It's about, just helping the one behind you and keep the doors open. That's very, very difficult to keep those doors open. And if there's not a door open, just take the window, find a different alternative. But that's how I see LATIMGs, with a beautiful community as we have now, just in different positions. I see board members, I see investigators, I see academics, all the different parts of not just a clinician, but at overall, in different like leadership opportunities where they are actually able to shape healthcare in the US and to help others. So that's how I see the organization. I'm very grateful for everyone. We have a lot of great volunteers that are supporting our organization, and we definitely need more sponsors, because we're a nonprofit. So yeah, we have we our way of helping our IMGs is by supporting them with scholarships, with mentorships. And it's very important for us to also have like that kind of support from the community.
Yeah, that's fantastic. Well, thank you so much for coming on our podcast today to talk to us,
Yeah.
learn a little bit more about your organization, because there are partners within our network too that are really wanting to collaborate with other partners. And so I think it's a great opportunity to get to know our partners. This podcast is going to be exposing all the partners to each other, and we hope it's the first step in many great collaborations.
Yes, definitely. I'm super excited about this. We have, of course, very, very a lot of interest in research, and we are so looking forward to the conference of NERI this
Yeah,
year. So yeah,
that's fantastic.
yeah. Hopefully, we'll see you everyone there.
Sounds good. Thank you, Julieta. Thank you so much.
Thank you.